My name is Deepti Jain, and I am a spine surgeon with the Center for Bone and Joint Surgery. If you have a compression fracture of one or more of the bones in your spine, you may be a candidate for a kyphoplasty procedure. The spine is made up of bones called vertebrae. You can see right here, these are individual vertebrae. The weight-bearing portion of the vertebra is this part in the front. This is called the vertebral body. The vertebral body has an outer shell of solid bone and an inner core that's made up of trabecular or porous spongy bone. If you have poor bone quality or osteoporosis, the inside of the bone can become very weak. Bending, sneezing, lifting heavy objects, all of these things can put more pressure on your spine that your weakened spine cannot support, resulting in what is called a compression fracture or a break in the bone, in which the vertebral body collapses. To reduce your pain, options that are non-operative include rest, pain medication, physical therapy, or a back brace. If these things don't work, you can also consider a small procedure called a kyphoplasty. This procedure is a 10-minute, minimally invasive procedure that I perform in my office. I place a large needle through your skin and into the fractured vertebra. I use a real-time x-ray machine called a fluoroscope to guide the placement of that needle into the bone. I then insert and inflate a balloon to make a cavity and help lift up the broken bone. After deflating and removing the bone, I then fill the bone with bone cement. I then remove the needle and cover the poke hole with a Band-Aid. This has been a very revolutionary procedure for my patients, as patients feel almost instantaneously better.